African American maternal and infant health needs are being able to provide fair and quality reproductive health care services. It is evident that they are at higher risk for pregnancy related deaths and poverty. Due to many African American women dying from pregnancy and childbirth, they experience more maternal health complications than white women. Ham et al. States gaps in maternal and infant mortality are rooted in racism, leading African American women to experience poorer quality care than white women. As Laura mentioned, 3 to 4 times and African American women are more likely to experience pregnancy related complications than a white woman. A development of a standardized screening tool for African American maternal mothers can help to identify stressors that are impacting Black women and can also allow a connection in the social economic disadvantage as well as discrimination. The National Partnership for Women and Families in 2018 states both social and health systems can contribute to high rates of poor health outcomes and maternal mortality for Black women. They are more likely to experience barriers to obtaining quality care and often face racial discrimination throughout their lives. The improvement of maternal and child health care will allow confidence in early prevention and increasing the ability to access easier, healthier, and affordable foods. Access to suitable preconception, prenatal, and postnatal care. It would also provide full support to Black women to reproductive health care services such as accessible screening and treating high-risk pregnancies. The need for addressing maternal mental health by identifying the barriers not allowing the Black women to access mental health services such as violence or even trauma experiences. Advocating for the need for advocation for change in policies, easier access, and affordable healthcare coverage, as well as contraceptive care and even counseling needed for these women. The need for education and addressing the effects of the comorbidities that African American women face prior, during, and even after the pregnancy, as well as development of techniques to reduce daily stressors. Also, giving them the confidence to empower in behavioral changes to their lifestyle, as well as the reduction of racial disparities. The need for advocacy will allow to access to clean, safe, and affordable housing. Due to many African American women do not complain of their housing situation, even if it's an unsafe environment. The improvement of quality of education, because many of them are undereducated or do not have the resources or are lacking the resources, as well as providing support groups, funding, and most of all, awareness. It was frightening to read that the Los Angeles County of Public Health reports to be the first jurisdictions to receive funding from the state to implement culturally specific prenatal interventions aimed to reducing African American maternal rates.